So as you can tell from the title of this video, I'm going to be talking about smear tests, or otherly known as pap smears, because I just feel that there isn't that much out there on the internet with people's personal experiences. So I just thought I would put mine out there, as I'm currently going through that now. I just think when I got my letter, I did go to YouTube to see people's experiences to give me some comfort, and there wasn't all that much out there, so I thought I'd put mine out there, because I just want people who's in a similar position to me to get that small bit of comfort, just to kind of see it from someone's voice and someone's face, you know, how it was, as if I was your friend and we're sitting for coffee and I'm just telling you how it goes and how it is. So I'm going to do this video in kind of two parts. I'm going to do a little bit of information right now off of the NHS website. So I'm not going to bombard you with facts, it's just on what a smear test is. Okay, so here we go. What is a smear test? So it says on the internet, if you type in on Google smear test, NHS generally comes up. So it says, cervical screening is not a test for cancer. It is a test to check the health of the cells of the cervix. Most women's tests show that everything is normal, but I sound like Jennifer Ross. But for around 1 in 20 women, the test will show some abnormal changes in the cells of the cervix. Most of these changes will not lead to cervical cancer, and the cells may go back to normal on their own. However, in some cases, the abnormal cells need to be removed so that they cannot become cancerous. So that just means that it detects for precancerous cells, so it's not necessarily always got to cancer, it's just pre-cancer. It says it's possible for women of all ages to develop cervical cancer, although the condition mainly affects sexually active women between the ages of 30 and 45. The condition is very rare in women under 25. I know there is a bit of uproar at the minute because there was a case recently of a 19-year-old who unfortunately did get cervical cancer, and it was detected too late and she passed away. And my thoughts go out to her family, and that's why I think they put the age bracket up to 25. I think it initially was 21, but anyways, I'm not going to go into that. So it says that women between the age of 25 and 64 are invited for a cervical screening test. Women between 25 and 49 are invited every 3 years, and women between 50 and 64 are invited every 5 years. It just says that being screened regularly means that the abnormal changes in the cells of the cervix can be identified at an early stage, and if necessary treated to stop the cancer developing, so before it even becomes cancer. It is estimated that early detection and treatment can prevent up to 75% of cervical cancers. Okay, so it says the actual test itself. It takes around 5 minutes. An instrument called a speculum will be gently inserted into your vagina to hold the walls of your vagina open so that your cervix is visible. A small soft brush will be used to take some cells from the surface of your cervix. The sample of cells will then be sent to a laboratory and examined under a microscope to see whether there are any abnormal ones. Some women find the procedure a bit uncomfortable or embarrassing, but for most women it's not painful, and I can actually vouch that it really wasn't painful, but I'll go into my experience a bit later. If the test picks up abnormalities in the cells of your cervix, it may be recommended that you have treatment to remove them, or further tests in a few months to see if they've returned to normal on their own. Okay, I think that's about it, and that's all you kind of really need to know. Okay, so that's just the kind of basic facts. So now I'm going to talk about my personal experience. Okay, so for me, like I've said earlier, you get a letter through when you're 25 or around your birthday. Generally I think, I mean in mine and my family's and friends' experience, the letters come roughly a month before your birthday. Mine came in December, and natural reaction I guess is anxious, worry, because you just don't know what to expect. So obviously I turned to Google, YouTube for just information, but all I kind of kept getting was facts, 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 facts. And I just wanted someone to kind of tell me like, oh, it's this. I know I have family and friends, but you know, other people's experiences. So anyways, so I got my letter and I booked it, and funnily enough my mum was due exactly the same time as my first one was. So we booked it in together, kind of one appointment after the other. But when we got there, my mum asked if I can go through with her, and the lady was fine with that, because it was the same lady. And we sat there, and because it was my first experience, it wasn't my mum's first experience, she's had quite a few, and my mum herself has previously gone through abnormal cells, and she had to have them lasered off. So I'm not too sure whether hers every 3 years or 5 years now, because I think it was quite a while ago. Anyways, so the lady gave me some information, asked who wanted to go first, and I wanted my mum to go first because I just really, I know she told me it was fine, but I wanted to kind of hear if she kind of did that uncomfortable like ouch or pinching sound, like they were really uncomfortable or painful. So my mum went through, and the lady sat outside with me, and when my mum was ready the lady went through, and I'm not joking, I must have gone out my phone, gone into one app or something, and the lady who was doing it, the nurse, she walked out, and I thought, oh, my mum's like, she's not done it yet, like something, maybe she's forgot something. And then a few minutes later my mum walked out, and I didn't hear a peep. Just the lady explaining to her what she's going to do, and that was it. And even I was like, oh, I hadn't prepared myself, I thought it would take longer than that, but yeah, she just walked out and was like, yeah, okay, your turn, like I was giving blood. And I went through, I was really nervous by this point, I think I'd worked myself up, I was getting, and I went through, the lady went out with my mum whilst I unchanged. You just take off your bottom half, and you lay on the bed or table, the cushion table, and you shimmy your bum all the way down to the very foot of the bed, and I can't remember if I had stirrups or if I just had my legs kind of up, if that makes sense. I can't remember, I'm really sorry about that. Anyways, I think they were in stirrups, I think so. And the lady asked if you were ready, and I was. So you put the paper towel over you, and she goes down that end, and I think where I get nervous, I get tense, and I stop breathing, I kind of hold my breath because I'm like, and she just kept trying to do all the bits, you know, relax, stop clenching your hands, because I think I was so like tense that nothing was happening. So she put it in, speculum in, and it didn't hurt at all. I'm surprised, to be honest with you. I was expecting more kind of scratching and pushing, and just because of what I've read before about the scratching, can't say I felt anything, well, with the speculum. And I just remember she sat back, and I said, oh, is that done? And she said, no, your cervix is too far back, I can't use the one I've got, I need to use the longer speculum, I guess. Which initially felt really embarrassing, but I was like, it's only my cervix, like, you know. So she got the longer one, and she kind of went down there, and again, I didn't really feel anything. You tense because it's your natural reaction to tense, but I didn't feel any pain. And then next thing she's like, okay, that's it. And it even again shocked me. I was like, hey, what do you mean, like, that's it? She's like, yeah, it's done. It's like, oh. She's like, you know, when you're ready, come out. So got myself all dressed and stuff like that, sat outside, and she kind of just went through that, and it was quite nice. It was quite light-hearted because I was with my mum. It was quite light-hearted that we were kind of distracting away from it. Anyways, so I think they say you get your results between 1 and 2 weeks. My mum got her results after a week, saying everything was fine, there was no abnormal cells, and I think in my heart I just knew that, well, when it comes to me, I'm really unlucky, but I think I just knew that I was going to have something. I don't know what, I don't know why I thought that way, but I just knew, especially as it was taking a bit longer, I just thought something is going to come back, a different letter to my mum. So anyways, I've got the letter here. Okay, so I'll just show you how it comes. I'm going to hide my dress. So it just says the cervical screening test. So I got this about 2 weeks later, but don't think that if yours is taking 2 weeks, as in your results, don't think that you're necessarily going to have abnormal cells. 9 times out of 10 the letter will just take 2 weeks, or longer maybe, depending I think where you are, but don't think that if it's taken 2 weeks that you should worry. And it said this: thank you for attending your recent cervical screening test. The report from the laboratory showed borderline changes. This means that there are changes to some of the cells in your cervix. These changes sometimes happen. They are not cancer, and in most cases do not lead to cancer. It just says, please contact your GP or the person who did your test to discuss the results if they've not already contacted you. A further investigation called a colposcopy is needed to determine whether any treatment is required. Colposcopy is a detailed examination of your cervix, and it will take place at a hospital outpatient clinic. The procedure is very similar to the cervical screening test. The enclosed leaflet, the colposcopy examination, gives more information. It's important that your cervix is checked in more detail to make sure there are no cell changes which could become serious in the future. If colposcopy shows you need treatment, you will usually be treated as an outpatient, and there will be no need for you to stay overnight. A colposcopy clinic appointment will be arranged for you. If you do not receive this appointment within the next 2 weeks, please contact the person who did your test. So that was that. So then I just had to wait for the next letter. It doesn't actually say the date on when I received this letter. But anyway, in due course I received my other letter. I'm not going to show this on because it says what hospital I am at. So it just says, thank you for attending your recent cervical screening test again. The report from the laboratory showed that your cervical screening result was abnormal. This means that there are changes to some of the cells in your cervix. A further investigation called a colposcopy is needed to determine if any treatment is needed. Colposcopy is a detailed examination of your cervix and takes place in... I think I've just read that, so maybe they've just copied and pasted it. Appointments been made for you for the 3rd of April 2014 at 10:10. So that's in a couple of weeks. So because I had, I guess, 6+ weeks to wait, there's a part of my head, there's a part of me that thought, well, if it was that urgent, they would have got me in straight away. So that comforted me. But I'll be completely honest, because I want to be honest with you guys with everything. The time that you're waiting to have this test done, you go through so many feelings and so many emotions. I know it's just to detect if there is any precancerous cells, but you can't help kind of freaking out or getting anxious and dreading the wait. The wait is what I think is the worst part. I mean, 6+ weeks to kind of think, well, there's abnormal changes, am I waiting 6 weeks plus, and what if there's something there and it just grows? There's so many questions you want to ask, and there is nothing that comforts you. Absolutely nothing. No matter how many people tell you you'll be fine, you just need it done. So anyway, that's what I've been up and down with, I guess, among a couple of things, but it's something that just is on your shoulders, and I can't wait to just get it over and done with, and that's just my honest personal feelings and opinions. And what was I going to say? I was going to say something. Sorry, yeah, I've completely forgot and then remembered. So in one of my first vlogs, I explained that I went to the doctors about a sinus infection, and I did, and I got antibiotics, everything like that. I also went to discuss with the doctor my results, because it does say in the letter, if you haven't heard from them, then you call who did it. However, when I went and sat with my doctor, there was, I think, someone in the room next door who she'd just seen. Something was happening and there was an ambulance coming, and she was in and out of my appointment. And I kind of just said to her, you know, I explained the situation. I said, it says that I can talk to you, so that maybe you could look on the system and kind of give me some comfort, because I'm having a lot of anxiety, and I am worrying, and I'm going to be completely honest with you. She just turned around and said, I can't really tell you any information until you've had your colposcopy. I was like, oh. I came for some reassurance and I got diddly squat. So yeah, to say the least, we're in now looking back on my video vlog of the day of the appointment. I was going to vlog as soon as I came out of the doctor's, but I got a bit upset on the phone to my mum, so I wasn't in the best facial place to be vlogging. Anyways, it says that you need to call up to confirm your appointment. If you do not attend, you'll be discharged back to your GP's care. And you get this little like booklet saying about the colposcopy examination. So again, I'm just going to read you a little bit on what a colposcopy is. Okay, so sorry about the kind of crease. Colposcopy, I'm going to read you a bit of information about that, well, as much as it tells me. So the first question in there is, why do I need a further examination? You've been asked to come for a further examination because your cervical screening test has shown evidence of abnormal cells. Alternatively, you may have been referred due to having had a number of inadequate results from your screenings. An abnormal result is not unusual. It happens in about 1 That's 1 in 20. 1 in 20 tests. It just kind of explains that you've got abnormal cells. So what is the colposcopy? Colposcopy is a simple examination that allows the doctor to see the type and area of the abnormality on the cervix. It also lets the doctor decide if you need the treatment. The instrument used is called a pulposcope, and is really just a large magnifying glass which lets the doctor look more closely at the changes in your cervix. Oh. I'm reading this, I've read this so many times and every time it feels new. It does not go inside you. For most women this is a painless examination, but some may find it uncomfortable. Colposcopy can be done safely during pregnancy and will not affect delivery of your baby, nor will it affect your ability to become pregnant in the future. However, treatment is usually postponed until after you've had the baby. Is there anything I can do before the examination? You're welcome to arrange for a relative or friend to come with you. In some clinics, they will be able to stay with you during the examination. Some doctors prefer not to do a colposcopy examination when you have your period. If this is the case, ring your clinic. The actual examination only takes about 15 minutes, but allow at least 1 hour for the whole visit. You may wish to wear a full skirt to avoid removing your lower clothing. Some women have a slight discharge after the examination, so you may want to bring a sanitary towel. What happens during the before the examination? First, the doctor will want to ask you some questions. These type of questions relate to your periods, contraception, any operations or illnesses you've had in the past. What exactly happens during the examination? The colposcopy nurse will help you to position yourself on a special type of couch. The couch has padded supports on which you rest your legs. When you are lying comfortably, the doctor will gently insert a speculum into your vagina, just as when you had your cervical screening test. Sometimes another test is taken. After this, the doctor will look at the cervix using a colposcope. The colposcope is a specially adapted type of microscope. It says that the doctor will then dab different liquids onto your cervix to help identify and highlight any areas of abnormal cells. The abnormal areas will appear white. If any abnormal area is identified, a small sample of tissue, a biopsy, will be taken from the surface of your cervix. A biopsy is about the size of a pinhead. You may feel a slight stinging, but it shouldn't be painful. What happens after the examination? After you have dressed, the doctor may be able to tell you what's wrong and what treatment, if any, is needed. But often, especially if you have had a biopsy, you will not be given a definite diagnosis immediately after the examination. It will take a week or two before you get the results of the biopsy. After the examination, you should feel well enough to continue with your usual routine. If you have had a biopsy, you may have a light blood-stained discharge for a few days after your procedure. This is normal and should clear by itself. However, it's best to refrain from intercourse for up to 5 days to allow the biopsy site to heal. What will the examination show? Colposcopy defines the type and extent of the abnormal area on the cervix. The results show if you need treatment and if so, what sort. The result of a biopsy shows how abnormal the area is. It may also indicate if further treatment is needed. The technical term used to refer to cell changes confirmed by a biopsy is cervical intraepithelial neoplasia, more commonly known as CIN, because I can't really say it. In order to make distinctions between the various stages of change, doctors have developed a scale from 1 to 3, according to how many cells are affected. CIN 1 means that only a third of the cells in the affected area are abnormal. These may be left to return to normal or may be treated depending on your doctor's opinion. CIN 2 means that up to 2/3 of the cells in the affected area are abnormal. Treatment will usually be needed to return the cells to normal. CIN 3 means that all the cells in the affected area are abnormal. Treatment will be needed to return the cells to normal. Only very rarely will a biopsy show cell changes that have already developed into cancer, so very rarely. Surgery and more extensive treatments are generally used to treat cervical cancer. It goes on to say what if I need treatment, which I'm not going to read because that's something that might not happen or it's very unlikely to happen, so I'm not going to read that. It does go on to say that most colposcopy clinics have a follow-up check between 4 and 6 months after the examination or treatment. During this visit, the doctor will take a cervical screening test and may do another colposcopy. So you just get seen, I think, a bit more initially. So yeah, that's pretty much everything. I know I've bombarded you with information which I didn't want to do, but actually it might be a bit helpful. So yeah, so I've got another 2 weeks roughly till my colposcopy, and I will kind of keep you guys in the loop and tell you what's going on. I hope it's just a case of small abnormal cells and they'll just check every 3 months, and that it's nothing, you know, too, I don't mean too serious, I mean there's nothing, I hope it's okay. That's my main hope. So yeah, I hope this video has remotely been helpful, or it's just kind of soothed you guys in if you're worried if it's painful or not. It's really not painful, smears. I can't say or comment on a colposcopy because I haven't had it done yet. But in terms of the smear, I didn't find it painful. It was more myself that was uncomfortable in terms of how tense I went. But generally it's so soft, I didn't necessarily feel pain. So my advice for anyone out there who either has just received the letter, or you've got your letter and you're ignoring it, or if you're having any my advice is, if you're having any problems untoward, it says as well on the internet, if you are bleeding in between cycles, I think bleeding after sex, and I think just bleeding unusually, as in if you've got a regular cycle and it's kind of by the book for you and you've noticed bleeding outside of that, then head down to the doctors, because it's best to just get checked out and just to kind of what's the word, just to make sure everything is fine. Probably is fine, but go to your doctors, don't hesitate to go, because it's your health and it's your life at the end of the day. So yeah, hope this video has been useful. And also, I'm just going to quickly go in there, I've got my cancer research badge. Also at the minute there's a no makeup selfie going on, and I've seen a lot of people on Facebook, Instagram and Twitter doing no makeup selfies in order for cancer research. So if you guys want to join in, take a photo of yourself with no makeup on, completely bare, and take a picture, and also text 70007 with the word beat, and that will charge you £3 going straight to the charity. It's a great cause and I'm very behind it. My stepmum died in January and she suffered with breast cancer, and unfortunately it did spread to other areas. So I know quite a few people who have had cancer, including my dad. So I just would say support the cause, guys. If you can afford £3, then text ahead. Yeah, and I hope you have a wonderful day, and I hope this has been some use or comfort. If you have any information or support or any questions, just like and write a comment down below. And if you'd like to see what happens with my colposcopy and, you know, my journey on that, then subscribe and I'll be doing future videos. Have a good day, guys, and it's Friday, so the weekend's here. And I've got my cat in the background. Oh, she's checking herself out in the mirror. Anyway, so have a good weekend and I shall see you all soon. Bye.